Hello once again, I am Toyin Odutola aka Miss Bash, the Sòrò Sókè Physiotherapist. Alright, we are here once again. This story was actually a very sad one at the beginning. So that video showed a boy when he was born, he had paralysis on one of his upper limbs. And it was actually devastating. The mother was sad, depressed. Like, what is this? How did this happen?
This is the story of a woman named Ruth, who lives in Lagos, Nigeria, with her family. Ruth is a teacher, married to a businessman, and a devoted mother. In 2019, she welcomed her first child, a healthy baby girl weighing 3.5 kg, through a smooth vaginal delivery. The experience was positive, and for a while, she chose to focus on her career before considering another child. In early 2023, she became pregnant again. As her pregnancy reached 39 weeks, labor had still not started. Ruth, feeling eager and ready to meet her baby, requested a cesarean section. However, her doctor advised her to wait a little longer. An ultrasound scan estimated the baby's weight at 4 kg, and everything appeared normal. On November 29, 2023, she began to notice subtle signs of labor and was induced. Based on her previous delivery and the scan results, the medical team believed she could safely deliver vaginally again.
Labor progressed quickly, but the outcome was far from expected. After the final push, Ruth delivered a baby boy weighing 5.4 kilograms, significantly larger than the estimated weight. The delivery caused a severe tear, and she experienced heavy blood loss. She was immediately stitched to control the bleeding.
Ruth only caught a brief glimpse of her baby before losing consciousness. It took 2 days before she was strong enough to hold her son.
2 days later, she was finally able to hold her son. In that quiet moment, the world felt whole again. A mother's love, pure and unbreakable.
During that moment, her mother noticed something unusual. His left arm was limp. It wasn't moving. The baby had Erb's palsy, a form of birth injury affecting the nerves that control movement on the upper limbs. His left upper limb was paralyzed. It occurred during delivery due to his large size. Ruth found herself overwhelmed with questions and pain. She struggled emotionally, wondering why a cesarean section had not been recommended earlier, especially given the baby's size. Despite her distress, she knew she had to focus on what truly mattered: her son's recovery. Physiotherapy began when he was just a few days old. The physiotherapy treatment process on the left upper limb was intensive and consistent. It included electrical muscle stimulation, passive mobilization, specialized splinting, and supportive bandaging of the affected arm.
After 5 days in the hospital, Ruth and her baby finally returned home for his naming ceremony. She was advised to bring him back every week for ongoing physiotherapy sessions.
Today, a beautiful naming ceremony was held. As the celebrations come to an end, Ruth reflects quietly.
In her heart, she knows it's time for her baby boy to return to the physiotherapist tomorrow to continue treatment on his left upper limb, which was affected by paralysis.
There were days Ruth cried through the therapy sessions. There were days she felt completely numb. At times, she could not bear to watch her baby in discomfort. The physiotherapist remained patient, compassionate, and supportive throughout. Ruth gently massages her son's left hand, doing all she can at home to support his recovery. At 3 weeks, there were slight movements in his shoulder, fingers, and hand.
Ruth brought her son back to the physiotherapist on her own, continuing his weekly therapy sessions.
At 2 months, the improvement became more noticeable. At 3 months, he could lift his arm better than before. By 6 months, the deformity was barely noticeable, though some limitations remained. By 9 months, his recovery had advanced significantly.
After 11 months, he was discharged, with a follow-up scheduled at 12 months.
Today, Zama is 2 years and 4 months old. He runs, plays with his sister, and uses his left hand so well. No one would ever suspect his left hand was once paralyzed. His recovery is remarkable. His arm has caught up beautifully. Ruth remains deeply grateful, so happy seeing her children playing in the living room. Physiotherapy did not just restore movement in her son's limb, it gave him a future free from deformity, a chance to live fully, and a story that now inspires hope.
These stories are real life stories, and I actually have with me today someone that had this very similar experience. And she's here today because we really wanted to understand the impact physiotherapy had in the life of her son. You know, bearing in mind that having to get the news that your son's arm is paralyzed after delivery, do you know what that feels like? It was something that was really hurting, and it really affected our emotions at that time. I have with me here Tobore. You're welcome.
Thank you very much.
And then I have Ife is with me today. So we're going to be talking really about the story you just watched. And Tobore, I know at the time you got the diagnosis that your son had Erb's palsy. You know, Erb's palsy is a condition that occurs when the nerve that supplies a particular upper limb is damaged. And this happened during delivery. This trauma happened during delivery. I particularly took note of the fact that you did a scan prior to delivery, and the scan revealed that your son the fetus at the time was 4 kg. 4 kg. So you know, just thought to yourself that you would rather have a cesarean section, and which was a good thing. But the doctor didn't think you needed to do a cesarean section. But when that happened, there was a tear. The baby now, you know, was even bigger than envisaged. He was now 5.4 kg, very big. Yeah, I understand that at that time you were not aware of the fact that physiotherapists also do antenatal care. Because if you had been doing that, you probably wouldn't have had that experience, that much tear and all. Okay. But with the knowledge you had at the time, you wanted to do a cesarean section, but the doctor you saw then didn't think it was necessary. But you knew that you would have needed it. Okay. But if you had done the cesarean section, your son wouldn't have had paralysis on that upper limb. Okay, that happened. What's the way forward? We don't have to dwell on what happened. What do we do at this point? I just want to ask you, how did you feel when you got that diagnosis?
Okay, so when I had my baby, I couldn't see him for like 2 days because I lost a lot of blood after the stitching. In fact, I passed out. Wow. After they finished stitching me because of the tears I had. Wow. It took about 4 people to carry me just from just here to the bed here. And they had to place me on oxygen, and it was a whole lot. I couldn't carry the baby when he was in care of the nurses until 2 days' time. Okay. So by the time we carried him, I didn't even notice anything because I was weak. I was still on, what do they call it? Is it catheter? So I wasn't really myself. Okay. So it was my mother that noticed, I think, did the 4th day that this boy, when he cries, he licks only the right, doesn't lick the left. And I said, what's going on? I'm still trying to recover.
Even recover as a woman, postpartum.
The boy is fine now. She said he's not, because my mom is a very meticulous person, and I bless God for that. Wow. So she said they baited him only once. One of the nurses said, hey, did they press him? I said, no, not likely. The nurses here, at least they know small work now. Why would they at least small? You know? So she said, it must be the nurses. I said, I don't know. So before we called the attention of the pediatrics, when they looked at him, they said, oh, yeah, physio. I said, what is physio?
What is physio?
So I learned a lot of terms.
Wow,
I learned, in fact,
interesting.
In fact, I'm even hoping that one of my children, they should do medicine, like for the suffering I've gone through. Like that's the only way they should compensate me. So they checked, we started the physio, and one of the physiotherapists said, so what's happening with your son is Erb's pulse. And I was like,
what?
I read this thing for Wiki. I read them for Wikipedia. I read it because, in fact, that pregnancy was so very interesting because I was already big. The child was big. It was bigger than the first pregnancy. And I was told when you have the second pregnancy, there's a tendency to be bigger. So I just said, you know what? We will do CS. We'll just they eat. I can't. I said, and I heard CS is not even as easy. No, because there's this thing people say, vaginal birth, Hebrew woman is better. CS
is actually
CS is
better.
For lazy.
Even CS has its own recovery complications. A lot of people don't know this. And they demonize it so much. They think maybe, CS, the woman just lies down. They bring the baby out. Alas, she's moving around. No! Recovery with a cesarean section is equally very painful. And it takes even longer. So demonizing CS is something people really need to stop.
Exactly.
Because whether you birth your child via vaginal delivery or a cesarean section, both are also, prove that women are strong.
Women are strong.
Because both processes have its own pros and cons. There's nothing easy. With either. There's nothing easy. So I believe that because of your knowledge on what, the benefits of a cesarean section would have been, was why you decided that, okay, I think I would want to do a CS because I see that my baby is big. But the medical personnel, the doctor you saw, didn't think it was necessary.
In fact,
what exactly happened at that point?
About the hospital, it was a general hospital. We were seeing different doctors every week. So I missed having that one-on-one follow-up care. So this one will review and say, okay, I think we should do this. This one will review. So when I even suggested the CS, I think at 39th or 40th week, they said, you know what, once it's the 40th week or 41 and you are not in labor, just come. So that was what happened. On the day I was, I just had a bit of show. And I said, okay, you know what, let's just go to the hospital. And I had to be induced. So coming back to when they said Erb's palsy, I had actually read it about it when I was at home waiting for. And I said, is it that the Bible says when Job said the thing I feared most, is it what's happened? What's going on? And they said, don't worry, it's going to take a bit of time. Just be coming for the sessions. You do this, you do that. I saw other children, other babies, some had, some couldn't even walk, legs, arms.
In the physiotherapy department.
Wow.
So you'd be like, wow. So
my mom said something. My mom said, our life don't change you. There is no excuse for anyone to have deformity in this. Maybe it's 21st century.
Absolutely.
If something can be dictated, why can't it be treated?
Absolutely.
So initially, I was, because of the exhaustion, both mentally and physically, I was like, you know what, he will be fine. Mommy said, no, like, we have to do this physio. There was something she said. She said, I'm a teacher, I'm a guidance counselor. And I deal with children who always have self-esteem issues. She said, how would you feel this boy is growing up? And one hand is shorter than the other. And let's even look at it. Maybe he's an adult. And the way he looks could be standing in the way of his maybe a job or the woman he loves. The hand is too short. He will ask questions.
Mommy, why did you do something about my hand?
You know. So my mom said, you know what, let's just be doing this thing. Let's do it. And, I even resumed work in between. I have to take excuse from work, and it was a whole lot. But I thank God for my mother. I thank God for my husband. And I really wish that the men, they can come around more and actually see what these women are going through. So I appreciate my spouse, my husband, for driving
Kudos
us.
to men.
He will drive us. He will drive us.
Kudos to men.
He will wait sometimes, but he will wait outside though.
He will
wait outside because
something.
No, the thing is, I understood his own pain too. He doesn't like somebody that injection, he doesn't like it. Then you now be doing
he doesn't want to add this.
So he will go outside. He's a pastor. He'll be praying. He'll be, you know. So week after week, it started with 3 times a week. We would. So there are days when they are putting the, what do you call it?
Electrical muscle
My mom will call it electrolyte. I say, Mom, it's not electrolyte. You know,
electrodes.
It will shock him. He will start crying, and they'll say breastfeed. I'll say, God. You know, there are days I will be crying as he's crying. There are days, you know, the physiotherapist will be like, it will go, don't worry. You know, they'll laugh around it. I will laugh. Then there are days I will just be numb. Like I'll pick my phone and press. I don't want to think. I don't want to, you know. So it was different phases for me. We're just coming and I was like, is this thing working? Is it working or is not working? I remember there was a day while you were, you know, doing it, and you just looked at me and you said, don't worry. It's like that. I understand. Don't worry. It will soon pass. You know, and later on I burst into tears. I was like, when is this thing going to end? How long? You know, but thankfully, I didn't really start seeing changes until, was it the 3rd or the 4th month? I saw that he could lift it, you know, and it didn't just end there at home. They had to teach us how to wrap. Aeroplane splits. In fact, it was a lot.
It was actually a lot. It was actually
a lot. So, but thank God that, you know, we began to see changes. You know, so it actually requires a lot of patience. It requires grit. And, you know, you just have to wait it out. It's a whole lot. It's a whole lot.
Okay, so it was actually an emotional season for you because I particularly remember I was one of the physiotherapists that managed your son. And, you know, there was this particular day that I had to first do counseling, you know. And this is one thing that a lot of people need to understand about physiotherapists. We don't just focus on the problem that, okay, the patient, the condition, okay, treat the patient and just go. We also do counseling. We educate the patient. We talk to them. There are times that if you are telling a patient or a client to do a particular thing, their mind is not there. They are bothered about the situation. We have to leave the physiotherapy aspect aside and take on the office of a psychologist, to encourage that child, the patient or the mother or the father of the child. And I remember during our course of training, during our training years in the university, psychology was one of the courses that we did in 300 level, 400 level, because they knew that psychology is a very key aspect of physiotherapy. So physiotherapists don't just treat with their hands, use manual therapy, electrotherapy modalities. We also have compassion. That aspect of compassion and empathy and, psyching the patients. When I mean psyching, counseling, more like counseling the patients, reassuring them that things will be better. Because there's a way the mind works. If a patient or a client has lost hope concerning a particular condition, when they lose hope, their mind is focused on the impossibilities. Yes. So, but as physiotherapists, we wire their mind in a different direction to see possibilities. Mm-hmm. So that's what we do. And that's what I primarily did for the mother at that time. She was depressed. She didn't understand what was going on. And, she had to even see other mothers. There was, they were like a community. Yeah. I said, so my own son's own is even better. So all that was giving her a psychological boost. That, okay, my own is also going to be better. So the moment they start to see changes, they are inspired. Yes. They are happier. So they are motivated to keep coming for the sessions. Okay, so this episode was sponsored by Peakline Care, a physiotherapy center here in Lagos, Nigeria. We attend to clients both online, telemedicine, or on-site. So if you need more information on physiotherapy services, please send us a direct message, send us an email, or click on the link below this video to learn more about us. Thank you. Over to you, Ife. I know that, in your course of practice, one aspect where you show care is having to be empathic. Yes. Because I know that you take your time to really educate your patients, talk to them, make them feel good. Because that in itself is going to affect the outcome of of what you're managing.
Okay, so one thing I would also like to add is that aside from the fact that we try to encourage our patients, we also look at the severity of the condition. That is what will determine the length of time it will take before they get actual recovery. Okay. So because one thing you don't want to do is give a false hope.
So
and then
you need to manage
you're
their
like, don't worry, in
expectations.
2
You need
months
to manage
you'll be okay.
their
And then it's
expectations.
2 months and the boy cannot still lift his hand. There will be problem.
Of course.
So one thing I try to also put in place when I practice is I look at the condition holistically to
how
see
long
how
is this going to
severe
take? How
it is.
severe it
If it is severe, I'll communicate in a way that would not be so harsh, but I would also try to let them know that it's quite serious than usual. So it will take a little bit longer than expected. So that way, both of us, I mean myself and the patients, have similar expectation goals.
Okay. Yes,
not that
absolutely.
I'm seeing 6 months and this person is seeing 2 weeks.
2 weeks.
At the end of the day, it can cause issues.
You're actually right. I remember the particular day. I can't forget that day, actually. I told her, I said, she asked me, she said, Miss Bash, how long? I said, let me be very honest with you.
Exactly.
It may take about a year. A year! So because it's here for a year. I said, yes. Because I had to manage her expectations. Yes. I had to tell her what it really is. This is going to go on for about a year. And that was what happened. At 3 weeks, we started to see progress. 1 month, 2 months, 3 months, 6 months, 9 months. Then by the 11th month, in fact, I could see the joy on her face that thank God I did this. So I was telling her at the 11th month that, okay, I'm going to give you an appointment now. That you'll be coming for a final checkup at the 12th month. That's when the boy clocks a year. So she said, okay, the date is on his birthday. I said, hey, on his birthday, even better. So let us celebrate his first birthday here. So I did that. And what I really want to say, what I want you to talk to people about is what now eventually happens with the relationship you have with physiotherapists. Okay. I'm not undermining any other profession in the healthcare sector, but what distinguishes physiotherapists is that we actually build relationship with our clients. Over time, after that incident, we became friends, we chat, we check up on each other. I ask about her kids. So that's what happens eventually. Yeah. So I'd like to share with everyone that impact on, the relationship you built with physiotherapists, how it helped you pull through those trying times.
Okay. All right, thank you very much. So the thing is, where we had the physiotherapy, it occurred in a general hospital. Yes, which of course we know how it works. Everyone is in a hurry, it's always crowded. So when I came in, it was kind of a surprise to me that practitioners here, they can take their time and ask questions. Don't worry, madam, wait. Don't worry, we'll attend to you. And because I'm used to, we're in a hurry. Everybody.
There's a lot of people
10 of you.
No time. It's a general hospital. A lot of crowd,
So when I say, don't worry. In fact, they say, before we even attend to your baby, let's attend to you. And I'm like, I'm done. They said, no, sit down.
We need to see the
mother
I think
first. I was referred for counseling to one of the
women,
one of the women
therapists.
And they were like, you didn't come. We've been here during antenatal. I said, antenatal, we're in a hurry. We want to take our urine sample. I don't know time. I didn't come.
Physiotherapy.
Okay, you didn't come. No problem. It's not late. So now let's do the
postnatal. Since you've had your baby
They were talking to me about how do I feel after birth. In fact, at that point, I was feeling like the truth is, I would just say this. Sometimes I battle with saying this. I was feeling like, why did I even have this child? Maybe I would have maybe I have child. There is proof that there's something there I can born. So what do I need to? Because sometimes, society will just put this pressure on you, and try for another one. And even after this one, some people will say, hey, when I will still try for.
Wow.
As if it's a bonanza. I don't know. Is there a giveaway?
Africans generally.
Honestly.
This boy needs a junior brother. He needs another junior. What is your business?
Honestly. So they said, really? So they said, madam, let's see you first. And they began to talk to me, I didn't even know that it was even affecting my marriage.
Oh, wow.
Yes, I wasn't happy. The first child I had what do you call it? PPD. Postpartum depression. So when that one occurred, I got out of it. It took about 2 or 3 years. Wow. I got out of it. Wow. Then I said, when I'm having a second child, I don't want to. I didn't have postpartum depression, but I was ill inside. I was,
tired.
Sometimes I would just tell my husband, after this physio, when we are going, stop me at one eatery like that. Let me just buy one rice.
I'll be all right.
Rice, food does not judge me. So I don't, every other person can judge me. So these were the things that, the counselors were talking to me about. Like, you have a child, in as much as you are doing the physio, you have expectations, but you should be fine. You should be fine with your child, your children. You should be fine with your husband. So I can't do marital counseling for
yeah.
Are we paying for this?
Because we actually do a lot. We do a lot. It's beyond what we treat.
Yeah. So that helped. Few sessions, but it gave me this consciousness. In fact, the lady even said, if you don't meet me here, you could send a chat, we could talk, anything, just let me know. So that's helped.
Sorry to interrupt you. That's one thing I really admire about the women's health physiotherapist. She really took her, because that's another area in their discipline.
Okay.
Before a women's health physiotherapist would even start treating your symptoms, they have to first work on your mind. They have to first work on how you think, how your emotions are. They counsel you. So that's predominantly what the women's health physiotherapist was doing for her at that time. So they were, they were working on her, postpartum. She just had a baby. So they were working on her. The pediatric physiotherapists were working on the baby. So it was a multidisciplinary approach within physiotherapy departments, because of course we have different specialties in physiotherapy. We have women's health, pediatric physiotherapy, neurology, orthopedics, sports physiotherapists, ICU, cardiorespiratory physiotherapy, even health promotion. So there are different aspects in physiotherapy. So she was privileged to benefit from the women's health physiotherapist and the pediatric physiotherapist. Please go on. You were talking about your experience.
Yeah, so at the end of the day, while we're having those conversations, I kind of had something to look forward to every time I come. At least I come to a place where, they talk to me.
You feel loved.
Yes, I feel, there is this care. And it's beyond, this is not just about your child. It's about you. It's about what's going on. Even my husband that, he's this, he's reserved. He doesn't like, he will come and say, hey, what about this doctor? Well, now you the ask of people. Okay. I didn't see you. I thought I'll see you today, And it's been a wonderful experience so that, not just the physiotherapy at that point, Sometimes when I even after then, I come to the hospital for another checkup, I could, easily walk into the department and say hi to everybody. Your son is big now, and all that. So it's been a wholesome experience. And I think, like what you are doing now, I salute what you are doing now. People should be aware of physiotherapy. I think even in schools, even when they're having career day,
we've already started doing that. I have a couple of colleagues that went to some secondary schools, private secondary schools, government-owned schools, to talk about physiotherapy. We actually had some students come to our hospital then for IT, and she said that she decided to study physiotherapy because somebody came to talk to them about physiotherapy. So, advocacy is going on, and it's a profession that is known globally. It is practiced in many countries in the world, in the US, in the UK, in Canada, in New Zealand, all over the world, but you have to be licensed to practice physiotherapy. There are so many quacks out there posing to be physiotherapists, and they are not. Physiotherapists undergo 6 years of training before they go for NYSC. 5 years in the university, 1 year internship program before NYSC, and then they get a permanent license to practice. So you need to be sure that whoever is attending to you is a licensed physiotherapy. Ask for their license number to confirm that they are physiotherapists. So that's why we are doing this kind of advocacy, to educate the public on the impact and the relevance of physiotherapy. So moving on to Ife, there was a time when she was coming for her sessions, and it was time to like introduce a splint, and splinting is an aspect of physiotherapy we do to correct deformities.
Yes.
The baby had what we call waiter's tip. Yes. The hand was towards the body. I don't want to use medical jargons. Towards the body, as though the waiter wants you to tip him some money.
Curved.
So it was curved this way. So I told her that, okay, you are going to be getting an aeroplane split. What is that? So you see, people need to understand the relevance of splinting when it comes to managing patients. At some point, the baby stopped using aeroplane splints when he was able to lift his upper limb above his head. We now introduced what we call a supination splint. So when we splint the arm, all bandaged and everything, it got to her. What are they tying on this, my son? So you need to just talk to the public to enlighten them on the importance of support when trying to correct a deformity.
All right, so before I talk on the importance of support, I would like to talk about something that you mentioned when you were speaking about how your mom noticed immediately that when your baby is trying to lift both hands, it's only one hand that goes up.
Was able to
so you see, a lot of people nowadays don't pay attention to their kids. So you're not even aware that there's something wrong with the child. So if there was no attention to that child, that would not have been detected early
enough.
And the longer it stays, the more severe it gets.
Absolutely.
So like we cannot overemphasize the importance of paying attention, especially that first 6 months of having your baby.
Yes.
Give them
it's
that
so
attention.
Important.
They need it.
It's so important.
Sometimes it's not even, it might be something else you notice. Maybe at 3 months, the head of the baby is not still stable.
Yes.
Why?
So ask questions.
You can only know if you pay attention to the
Absolutely.
child. So that's one thing that I would also like to talk about. Then as regards the importance of support, is very necessary. Because it's a mental thing aside from the fact that it's physical. So, and we as physiotherapists, we always encourage them. And then we always like to explain. That's like something I do. So that you don't just feel like the baby is being punished. Because that's how some people will see some of the things we use on the babies. Like, this, especially the electrodes. So when we tell them that it will send some electric shock into the body, they say,
like what?
You understand? So they feel like the baby is being like punished. So you have to let them understand that no, we are just trying to awaken the nerves. As soon as they can handle it themselves, then we'll withdraw this particular modality. So that's something that I always try to do, and I'm sure a lot of other physiotherapists always try to do.
Absolutely. So, like, to take a cue from what you said about early intervention, that's why it's very important that once you birth your baby, it's important they also do a physiotherapy assessment from time to time. You may think it doesn't mean it's not necessary. I would tell you for a fact that I've seen mothers bring their children, their babies to the hospital maybe 6 months after, complaining about something that should have been fixed at 3 months. So it's important to go for a physiotherapy assessment. It's something that physiotherapists do. We do assessment for an apparently healthy baby. Nothing like, it doesn't have to have a problem before you should take your baby to a physiotherapist. So when your child is a month old, or you're going for the immunization session, just branch, if it's a hospital where there's a physiotherapist there, just say, oh, you would like to do a physiotherapy assessment. They'll tell you what to do. From 1 month, 2 months, 3 months, 6 months, if your baby is not controlling the head or the neck properly, all these things needs to be looked into, because the earlier you start, the better. That was what helped our own son. She was in an euphoria of, why is all this happening to me? She was not seeing anything around her. Thankfully, she had a very strong support system. So her mom was able to see what was happening, that what's going on here. So early intervention is very key. We started seeing him at about 4 days old, or I think 3 days old or 4 days old. Yeah, that early. So that was what made him progress that fast.
Then something just dropped in my mind now. There are some practices too that we might have to learn to do away with, because when people just have their babies, some family members come around and pull the hand of the baby, twist
it.
you know, they are trying to show you
those
that
grandmothers that will tell you that so that the baby can they massage the hand.
You know,
Massage.
even if they are bathing the baby, sometimes they stretch the the waist and do all kinds of things.
You know,
so sometimes you might have to tell them, you don't have to fight them. Just be like, please.
From a place of understanding, you educate them.
You just try to make sure that they don't hurt the baby, because sometimes in the process of all of those
Doing
things,
that,
they can hurt the baby.
The baby, it's true, it's true. So that's why we are educating the public on the impact of physiotherapy and practices that could endanger the lives of our children, of the babies. Some practices are very unsafe. So you need to educate them. That's why even when, at the time she reported at the clinic, when she was bringing her son, we also did what we call patient education, where they are taught how to handle that baby. The hand must not be left hanging.
Yes.
Because the moment you start to do that, the paralysis will get worse. So handling was another thing we had to focus a lot on, especially the first few days after she had her baby. So patient education is one key aspect in physiotherapy that helps overall management, because when you educate the patient or the client, you tell them about the condition, you teach them what to do at home. Physiotherapy and home exercise program is like this. They go hand in hand. It has to work together. When you go home, the child is with the parents more than they come to the clinic or to the physiotherapy center or to the hospital. The mother or the father or the grandmother or the carer has to understand what needs to be done at home, so that whatever it is you're doing at home and what you're doing in the physiotherapy center has to complement each other. So today's episode has been a very interesting one.
And insightful.
And insightful too. And I believe you've learned something today. So in closing, would you like to say something to our audience about physiotherapy, the impact, how you feel? Because right now, if you see her son, you can't even tell that anything happened to him. He's just playing around, playing with his sister. Big fine boy. So just tell us, how you feel now, the impact, the experience.
This is beyond a profession for me. It's like it's a calling.
Thank you.
It's like
Thank
you
you
people
so
are
much.
people are blessed. It's not somebody with hot temper that can do this.
You have to be patient.
You have to be really patient. So I thank you for what you are doing.
Thank you so much.
Welcome, man.
Thank you so much. Thank you so much. So we bring this beautiful episode to a close. Sòrò, Sókè Physiotherapists.
International.
Yes, international. Thank you so much for joining.